Hi, this is Dr. Kevin, physical therapist and owner of Balance and Body Restoration Physical Therapy Massage, and welcome to day 2 of our Back to Basics Spine and Rehabilitation program, where over the next 30 days I will teach you how to build a spine and rehabilitation program from complete scratch, just taking you through a series of stretches and exercises just to help you increase your mobility, increase your strength, and increase the overall confidence that you have within your body in a way that I believe is the safest, simplest, and most effective way possible. And I just want to start with just a recap of day 1 and just to lay the framework for what I want to go over in today's day 2 routine. So in day 1, we just started to establish some of the absolute fundamentals and basics of how we want to approach this exercise program moving forward. So we placed a heavy emphasis on just helping you understand how to identify problematic breathing habits, and that a lot of people that we find with chronic pain, especially chronic neck and shoulder pain and lower back pain, just have problems with their posture, which affects their breathing, which makes them more of a chest breather than a diaphragmatic or belly breather. And we went over some drills and some exercises to help you identify if your breathing is problematic and just to help you try to find ways to correct some of those breathing patterns. And if you're in day 2, I would always recommend that you at least start with some of those those breathing exercises, because for some people it might take a couple of days for them to correct over time, and it's definitely something that is worthwhile for you to do because it'll only help you moving forward. We then started to move on into the very first stretching exercise, which was the cat and the cat exercise and the cow exercise, where we focused on teaching you how to start to approach stretching and movement. And this movement is called flexion or rounding forward, and this movement is extension or bending backwards. And that for a lot of people that are just starting off, it's very common for there to be some pain, some resistance, a lot of tightness, and just overall restrictions to your movement. But that's okay. That's what we actually want to find, and we want to start to use those stretches as a means of not just moving randomly. We want to use these mobility drills just to help you identify where you're stiff, where you're tight, or where you actually move well, and then start to use our breathing, start to use our just overall senses, and just to wake up our nervous system for us to start to increase that mobility over a period of time. So day 2, we're going to advance from the concept of flexion and extension of our spine and start to lay a new movement that is very commonly lacking for a lot of people who are, again, are struggling with chronic back pain and chronic back stiffness. Okay, so the movement that we're going to emphasize today is known as rotation, also known as twisting of the spine. So I just want to go over just briefly some of the anatomy and why it's really important for you just to understand some of this kind of core anatomy so that we can just have a better idea of how we want to approach exercise and stretching, especially moving forward into our program. So I'm just going to grab a model here of our spine and just to share with you some, what I believe, just some very, very important information that you should know regarding your own back. So just a very, very brief outline of spine anatomy. There are 3 general parts of our spine that we use to identify, with the upper vertebrae, known as our neck or our cervical spine. We have the middle part of our spine, which is also known as the thoracic spine. And we also have the lower back vertebrae, which is also known as our lumbar spine. Okay, and since we are working on twisting and rotation of the spine today, I want you to understand that there are parts of our spine that are more equipped to create rotation or twisting, and there are some parts of our spine that are just not as equipped to be able to handle that movement as well. So if you see here in the lower back, or also known as the lumbar spine here, if I try to create a twisting or rotation of the spine, it just doesn't really go very far or very much at all. Okay, just because of the alignment of these joints called the facet joints here, there's just not a lot of give for our bodies in our lower back to create twisting or rotation within the spine. where our bodies actually create most of the twisting and the rotation is actually in the middle back, known as the thoracic spine. So if you see, if I try to create twisting through here, it's very easy for the spine in this area to create that twisting, just because of the way that the alignment of these joints, especially these little tiny facet joints, work. Is that, again, there's a lot of twisting that can come in the mid back, and there's not a lot of twisting that comes from the lower back. So when we are doing exercises to try to increase our ability to twist and rotate, a lot of that's going to be actually focused on our mid back and through our thoracic spine. We don't actually want to do a lot of twisting and rotation from our lower back. So that's one of the most common problems that we actually see, which is at the root of why a lot of people have lower back problems, is because they're so stiff and so immobile in their mid backs that when they need to do some type of twisting maneuver, let's say like getting a dog or getting a kid out of a car seat, or just doing yard work where you might be kind of like bending forward and twisting if you're doing shoveling or anything like that. That's why we can see a lot of people with just their lower backs locking up, or their joints is becoming inflamed, because they're trying to create rotation where they're actually don't have that. Okay, so that's why today we're going to start to show you some simple drills and some exercises to help you increase your twisting movement, to make sure that you're getting it from the right area and that you're not prone to over rotating from an area of your body that just doesn't have the ability to do so. Okay, so let's get right into the 2 exercises for today. So to start the exercise portion of day 2, again, we're going to be focusing on the twisting and rotation of the mid to upper back. Okay, and as I said in the beginning, we want to make sure that we're focusing on creating the rotation where a lot of people lack rotation, so you're not prone to developing a lot of stress, a lot of strain in your lower back, because that area is just not really designed for twisting and rotational movements. Okay, so the first exercise we want to show you is called the open book stretch. Okay, so I have a pillow here just because I want to make sure my neck is in a comfortable position, and I recommend that you do the same as well. Is to just start by laying on your side, and I want you to bend your knees up towards your chest like so. Okay, the reason why I want to keep your knees bent is because having your hips up like so is going to help prevent your lower back from creating a lot of twisting motion where we just don't want it to come from. Okay, so I'll show you from a different angle. If I pull my hips up like so, it's going to be hard for me to create movement in my lower back, because I actually don't want to create a lot of movement through my lower back with this stretch. Instead, I want to be focusing on opening up my mid to upper back through here. Okay, so I can start to learn how to relieve pressure off of my lower back over time. So what I'm going to do here is pull my knees up towards my chest. I'm going to use my bottom hand here just to block my legs at the top. Okay, and again, this is just to help fix my lower back and fix my hips, to make sure that I'm not getting any extra movement there where I don't want it to. All right, and we call this open book because we're going to pretend this, my right hand or this top hand here, is like a closed book, and we're just going to open it all the way up and over towards the side here, like so. And just like in the first exercise, as I move into the stretch, I'm going to feel at some point some type of restriction, some type of tightness, some type of ending point where my body just feels like it gets stuck. It's at that point where we want to use what we learned in the first lesson to then take a nice deep breath through our diaphragm, just to help calm our nervous system down, just to give our bodies a chance to start to adapt to that new movement, and to slowly start to push through more movement over a long period of time. We're not trying to, again, set records or try to restore all the flexibility in day 1. We just want to just lay some groundwork of how to start to approach stretching and approach movement over time. Okay, so knees bent up, bottom hand blocking my thigh here, and I'm going to open up my chest, open up my shoulder, and I actually want to make sure that I'm actually turning my neck and looking towards where I'm turning towards as well. It's very common that you might get stuck right around here. A lot of people very stiff and tight through their mid back. Again, very, very common to see a lot of restrictions. So once you get stuck, once you get tight, take a nice deep breath in, out. Just slowly work as far as you can. The end goal is for you to eventually be able to get your hand, shoulder, entire arm to be able to touch the floor. But if you're really tight, if you're really stiff, if you're just generally restricted in that area, it might take a couple days and it might take a couple weeks. And in some cases, it might take a month or two for you to get all the way down there. But as long as you're making progress, then that's okay. Just work within your limits and just use your breathing as a guide to just help you establish how far you should be able to go. Okay? Breathe in here. Exhale. I'm going to do this 3 times. Big emphasis on breathing as always. Should feel a nice stretch, just elongation and just activation of the muscles along the middle back up towards my shoulder. And actually also might feel a lot of stretching, a lot of tightness in the pec muscles here in the front. That's okay. We actually want that. Okay. Last breath. All the way down here. Okay. Let's show it to you from another angle here. So knees up, bottom hand blocks my thigh. My top hand is the free hand that's going to guide and power me through the movements. I'm going to turn my head, turn my neck, and rotate and twist my arm all the way to as far as I can towards the ground. If I get stuck along here, just stay there for a couple of seconds. Take a nice deep breath in. Exhale. Just let gravity pull you down a little further until you feel the next tightness or restriction point. For me, it's right along there. Take a nice deep breath in. Exhale. Just slowly sink into the stretch. Don't force it if you can't go any further. Try not to fight your body. Again, the goal is once you get to those resistance points, just stay there. Just breathe and just slowly let your body adapt to these new movements over time. Okay, we're not in any rush here. We've got all the time in the world. Just slowly work your way. Try to get your hand all the way down to the floor. If you can't get there on day one, that's okay. Again, don't force it. Just let it gradually happen over time. I'm just showing you over time what should be capable of your body if you're able to practice this consistently over a long period of time. Okay. Now, I want to just show you a very quick variation in modification, because it's very common for a lot of our patients that they have a lot of shoulder tightness, a lot of tightness in the muscles here, and sometimes that can be the limiting factor. So if you get to a point where if you do this stretch and you're just facing a lot of extra shoulder pain or tightness here, then all you need to do is just, instead of having your hand out to the side, just put your hands right on your ribs, and as you try to get your shoulder towards the ground, just pull your ribs down through here. So this is called the open book with the rib pull. Same thing, once I get tight, once I get restricted, take a nice deep breath in through my nose. Exhale, just pull my ribs and just try to guide my shoulder towards the ground like so. Okay, one more time. Okay, so again, that's one modification. If you're just finding that there's just too much pain or too much tightness through the shoulder, just bring your hand in closer, but make sure you get that extra little bit of leverage by just kind of pulling your ribs down towards the ground and eventually trying to see if you can get your shoulder to touch towards the floor. All right. If you, for any reason, start to experience a lot of low back pain or a lot of low back tightness or things that are locking up, again, just kind of back off from the stretch, just take it a little bit easier, and maybe seek some type of advice or some type of care to make sure that this is an exercise that is appropriate for you. So let's get into the second twisting and rotation based exercise. Okay, so this is the second exercise in day 2 program, where we are focusing on helping you regain the twisting or the rotational movement, especially in the middle part of your spine. The first exercise we went over was the open book stretch, and this is a slightly more challenging but more rewarding exercise if you can actually do it properly. I would say that even though we're in day 2 and this is a beginner level, this is a beginner routine, this is definitely something that's safe for you to try. But if it's a little more difficult than you'd expect, then just stick with the doing more of the first exercise, which is the open book, and maybe integrate this in later days if you feel more confident. But again, definitely good enough for you and safe enough for you to try on day 2. But again, if it's just a little outside your scope, then just stick with the open book, and that should suffice for now. So next exercise is called the reach back exercise, where I'm going to just start by sitting on my hands and my knees. I'm going to sit my hips all the way down to my heels like so. And again, we want to be focusing on the twisting and rotation element of the spine. So all I'm going to do is place one hand, my left hand, right in the center of my 2 knees here. I'm going to place my right hand towards my head and my neck here. And what I want to do is just create some twisting and some rotation and try to point my elbow all the way up towards the ceiling like so. Take a deep breath in, breathe out, just hold it there for a couple of seconds. We're aiming for somewhere between 3 to 5 breath cycles, and then coming back down to the beginning. And let's show you what it looks like from the other side here. So again, just putting my right hand now between my 2 knees like so, left hand on the top of my head. I'm just gonna try to drive and twist and try to point my elbow all the way up towards the ceiling. Once I get stuck, once I get a little tight, I'll take a nice deep breath in, exhale, and just press on through the exercise just a little further, like so. Okay, so most people are not going to be able to point their elbow all the way towards the ceiling on day 1. I know this because I wasn't able to do as well, and this took me many weeks, if not a couple of months, to actually regain all of the movement that I felt like I could have had back when I was rehabilitating for my own back pain and my own back injuries. Okay, so I'm going to kind of show it to you one more time in a way that you might seem is more applicable to some of the problems you may face when you're just starting on this exercise on your own. Okay, so again, just kind of sitting on my hands and my knees, sitting my hips towards my feet here, putting my left hand right in the center and my right hand on top of my head. And a lot of people, once they start to initiate some of the twisting, might get stuck right along here, okay? But again, the reason why we emphasize breathing so much in the very first video is because we want to use our breathing to help drive and guide us through the stretch so that over time, our nervous system starts to relax and our tissues and our muscles are able to just create positive adaptations to these areas over a long period of time. So reach up, reach back. If I get stuck, stay there. Just stay there and take a couple of breaths. Exhale. Just get a little further into the stretch like so. And again, the goal isn't for you to get all the way elbow point toward the ceiling on day 1. The goal in the beginning is just to start to work through some of these movements that you may not have been doing in a long period of time, and just to start to feel and sense where your limits are, and again, start to use your breathing to help guide you slightly past your limits over a long period of time. Again, this is something that it took me several weeks to be able to regain all the mobility through this exercise. But once I did, it started to make such a huge impact because my spine started to move better. I could feel just a lot of activation along the muscles of my mid-back. My posture started to improve, my breathing started to improve, and my lower back started to hurt way less once I started to restore the movement in the areas that I needed to. Okay, so we're going to show it to you one more time from the other side. Just take you through the exercise one more time. Just reach back as far as you can to about here. If you get stuck right around here, which is very common, that's okay. Stay there, hold it there for a couple of seconds. Take a nice deep breath in. Exhale. Just go as far as you can until you reach that next tightness or resistance point. Just using your breathing to guide us through the stretch. Okay? It's 4. And that's 5. Okay? Notice with a lot of the stretches that we're doing, I'm not just counting to 30 seconds. I'm not counting to a minute. I'm actually timing my repetitions through the amount of breath cycles that I'm taking. So when I say 3 to 5 breaths, it means that each time I get to a point where I get stuck, I take a breath, I breathe in, I exhale, and I try to get a little more movement after that. That's one repetition. So if I can repeat that 3 to 5 times, 3 times if you're just starting off, 5 times if you are starting to become more used to it, then that's how I would progress this exercise moving forward. Okay. Now, I'm just going to show you one more modification in the event that you might be experiencing a lot of neck or shoulder pain or discomfort because of the hand position. Okay. So one way to easily modify that is by just placing your hand behind your back here, and just make sure that you're not allowing your shoulder to slump and slouch too much, that you're trying to kind of pull and retract your shoulder blade back to about here, and this should be your starting point about here. And from here, I'm just kind of opening and twisting from here, once I get stuck, nice deep breath in here, exhale, go a little further, a little further, a little further. I'll do one more. A little further. And again, I do this and I just get a lot of neck or shoulder pain or discomfort to the point where it's getting in the way of me being able to feel what I want to feel within the exercise. Just put your hand behind your back like so. Just pull your shoulder back a little bit, and then from here, just engage into the stretch. Deep breath in, exhale. Okay, and that's it for helping you identify and restore the twisting or rotation elements in the middle part of your back. So that's it for day 2. Hope you've enjoyed, and look forward to seeing you in day 3. Take care.